All right, we are back now with Dr. Madeline Cunningham. Earlier on the show, we were discussing all things PANDAS, some of the treatment options, and some of the symptoms that parents should be on the lookout for. So thank you so much for a little bit more time here this afternoon, Dr. Cunningham.
Oh, well, I'm delighted.
Okay, so I have to give a shout out to my friend Rose Church, who has been my go-to girl when it comes to all things pandas. Because when I was trying to figure everything out going on with my son Brock, she was just a wealth of knowledge and information, and so she actually has some questions that I want to make sure I can answer for her and kind of do my part to pay it forward to her for all of the help she has given me. So before we get started, we talked about pandas on air on CI Living, but let's talk a little bit about what led to your interest in PANS and pandas.
The National Institute of Mental Health called me because I actually had studied rheumatic fever for years. And we mainly studied the heart, but there also was a brain disorder that was associated with group A streptococcal infections that had some similarities to pandas. And this was called Sydenham's chorea. So we began our studies with Dr. Susan Sweeto, who provided more samples. We had seen a patient with Sydenham chorea here in the hospital and had made human monoclonal antibodies from the patient. And those actually led us to understand the antibodies that were in all individuals that have pandas. There is a group of 5 tests that we perform. And these are antineuronal autoantibody tests. 4 are just detecting the antibodies that are present. And the 5th test is to detect the functionality of the antibody as it attacks the neurons in your brain.
Okay, so in a lot of these cases, a lot of these symptoms, they do suddenly appear kind of overnight, like a little light switch just goes off. And usually, from what I have heard in research, it does come after a bout of strep throat.
Yes.
And sometimes they don't even test positive for strep. It's like they're a carrier or something like that, right?
It can happen like that. And also, you can have had strep previously, and if you test your blood for antibodies against the group A strep, you'll find that they're present, but maybe the infection was a few months ago, maybe it was a few weeks ago, and maybe you have contracted mycoplasma or a cold virus or influenza, all of these things, and including COVID-19, that perhaps can trigger neurologic symptoms.
Do you see an upswing in the number of children being diagnosed with PANS or PANDAS?
I haven't noticed that right now, at least compared to what we've seen. I mean, it's about the same, but it's much more than what we were understanding or seeing years ago when I first began work in Group A streptococcal studies, which was in the 1970s. We didn't even know such a thing existed, even though we realized that Sydenham chorea was a piece of rheumatic fever after streptococcal infection and that it was caused by an immune response against the body. But I think, we are more diligent now to recognize it. And so it's good because families perhaps kept their children in their homes
Yeah.
and hid there. And so now it's become okay to say your child has pandas, and sometimes it can even go with autism. So it's really a good thing that we recognize what's happening because it's treatable.
And speaking of treatable, before we get to that, who does this who do you see this affecting most? Boys, girls, children, teens? Is it
Uh,
something we can outgrow?
it's in boys 3 to 1, and this is not uncommon to see skewing like that in various types of autoimmune diseases. For example, lupus is primarily in women, but OCD, tics, and pandas and PANS and is in primarily, I say primarily, it's 3 to 1. It's quite a large number, 3 to 1 more in males. This is not the case in Sydenham, Korea.
Now,
It affects both sexes about equally.
is this something, do you think, once children hit puberty, that then maybe symptoms will go into remission?
Well, I don't want to really say that that's true. I think maybe by the time a child reaches 20 and their brain development and their immune system development is near completion, that they begin to correct some of the problems that they had as children with an underdeveloped immune system.
And so for those parents who are seeing these type of symptoms and they're not sure what's going on, from my experience, getting on it quickly is
Absolutely.
key because you
Yeah.
don't want to let things just progress and get worse.
And it
And
becomes
what do you think is like the first line of defense? What do we need to do first?
Well, once you recognize it, then you need to certainly go to your doctor and find out if you have strep. I mean, that is the number one thing to do. And then, of course, if you have strep, you want to be treated. And you can test for strep in several ways. You can do a throat culture. You can also take a blood sample to test for antibody that detects whether you had a strep infection previously. Because in rheumatic fever, often the strains of strep were not isolated because the children did not get sick for 2 weeks or a month or 2 months. And in some cases of Sydenham, Korea, it can appear up to 9 months following an infection. And so it was so difficult for clinicians to actually connect the strep with the Sydenham, Korea, just as it has been a big argument about pandas.
And I think a lot of time pandas patients are misdiagnosed because maybe doctors around the world or country, they just aren't familiar with pandas. That was my experience with Brock, which as a parent is very frustrating.
Yes.
And when you feel like you're on the right path to helping your child and you keep getting doors slammed in your face, it's quite frustrating. So how do you convince your family practice doctor, I need answers, we need to be doing something, here's my research? What can we tell them to convince them that we're not crazy?
Well, it's very unnerving to have doctors tell you that you're crazy or that your child is crazy and that there's nothing that's wrong biologically with your child. And this has been a common problem over the years up until now. And I think now we realize that there are a whole group of neurologic diseases that are autoimmune encephalitis, they're autoimmune psychoses, and they're brought on by autoantibodies. And not in every case can you pinpoint the exact infection, but you can recognize it as you're educated. I mean, of course, that's why this program is so great, is that anytime there is a chance to educate the public, to educate doctors, to educate parents, so that they can identify it. Then once you've identified it, there is I mean, we have a consensus paper that describes the diagnosis. We have 4 papers that have been published with treatment guidelines that talk about the treatments that include the psychiatric and psychological care of these individuals, and then treatment with antibiotics to prevent infections. And eventually, if you've got resistant disease, then perhaps using intravenous immunoglobulin if it's appropriate. And then if a child is extremely ill in the hospital and it's a desperate situation, then use of plasma exchange or plasmapheresis or rituximab might be important to use in those situations, because anorexia can be one of the symptoms. It's in a small percentage, like 7% of the patients may present with anorexia. And some may get well after months of time, but others may not, and it may become a very serious anorexia that's so life-threatening. So that is why it's important to recognize it, and not only anorexia, but where an individual is really psychotic, or they have developed such behaviors that they really can't exist outside of their home.
Yeah. I
So
mean,
it's
even suicidal thoughts, I know, take over some of some PANDAS patients, which is just
suicide,
frightening.
suicides do happen, and we have patients that are just so fearful. They're so tired of feeling like that.
Yeah.
They
Well,
just want someone to kill them.
I know, it's sad. And something I want to mention is when they go to the doctor, can a parent request the Cunningham panel? Is that something that you recommend them trying to
Yes,
pinpoint
they
things?
can. Yes, they can actually um, ask for the panel, and it is at Molecular Labs. Um, the website has a portal for ordering, but there are phone numbers on the website that can be used, and you can reach out. It's molecularlabs.com or
Okay.
molecular.com. The website is there and also explains the disease and tries to educate both doctors and children.
Okay.
And
Well, we will
it,
connect people with that for sure on CILiving.tv. Last question, Dr. Cunningham. Is there hope for families out there who are struggling with a child who has PANDAS?
absolutely, there is so much hope because if you can identify the infection and treat it, an example is that children with rheumatic fever are treated for some lot for their lifetime, but
Yeah.
usually until they're 18 to 21 years old with antibiotics to prevent a strep infection.
Yeah, well, I
Oh,
hate that I'm a part of the community of mothers who have a child with PANDAS, but I am all about raising awareness for it and helping those families to navigate the disorder and to share that there is hope. And but if you have a child who has had strep throat and is now just kind of flipped a switch and you're experiencing symptoms that are unlike your child, do not delay. Please go get them seen at a physician and request that Cunningham panel that Dr. Cunningham has come up with. Dr. Cunningham, thank you so much. I
you're so
appreciate this more
welcome.
than you
Thank you
know.
so much.
Yes, thank you. Again, all of this information is on CILiving.tv, which is where you're at right now, hopefully.
Thank you, Heather.
Thank you.